Good morning, everyone, and thanks for joining. Glad to be able to share with you today an update for the Department of Medicine. I can tell you one of the great benefits of reviewing, having the opportunity to review all the achievements and accomplishments of the department and all of you individually is to see how much has occurred and how much has gone on. And it's really both inspiring and humbling. And it's really a real honor to be a part of this. And I am, again, pleased to present this to you today. The chiefs tell me that they'll put in the chat box the code for CME, so you can get that for this presentation as well this morning. So I'll cover some general background type of topics and issues, focus on clinical and quality of various programs, education and research. I can tell you that from the very outset that I will not have the opportunity to cover everything. There's just an enormous amount of activity that's going on in the department. So I'm sorry if I leave something out. Just trying to fit as much as possible in a limited period of time is a big challenge. So firstly, we've had a whole bunch of new faculty that have joined this past year. Dr. Amasika, Dr. De Silva, who people might think has been here for some time, really just joined us in the last year when she completed her chief residency and is in the general medicine group and has been very active in ambulatory care practice. In geriatrics, we have Dr. Chin, who has joined us and in the middle of the year, and he has established a geriatric practice both on the inpatient and outpatient side, and very excited about that happening for us in the department. Dr. Paris joined in medicine pediatrics and brings also special expertise in IT. In the hematology oncology group, we've had two new faculty join. Dr. Shah has been with us now for about half a year or so, maybe less. And Dr. Lee just joined in the past couple of weeks and adding to the overall great hematology oncology physician workforce that we have. In GI and gastroenterology and hepatology, we've had several new people join. Dr. Tafesh has been with us for a whole bunch of months right now and has done a tremendous job as a gastroenterology hepatologist. Also in gastroenterology, just recently started is Dr. Haji Fafelian, who is an advanced endoscopist and who brings to the table also the capacity to perform bariatric endoscopy services. In hepatology, Dr. Wakil just joined recently. We look forward to his contributions in hepatology. In cardiology, Dr. Feldman joined earlier this summer after completing training in cardio-oncology, and is setting up a program specifically for cardio-oncology that is now recognized as a separate area of expertise within the American College of Cardiology. And Dr. Bedno joined us several months ago as the new head of occupational medicine and has been very active in numerous programs related to occupational and preventive medicine. In hospital medicine, we have two of our graduates who have joined just recently, and we look forward as well to their work and help in a pivotal program where we provide services at University Hospital for the inpatients. In basic science faculty, we've had Dr. Chan, who has joined at the Center for Emerging Pathogens. Dr. Chan will also be serving as the director for the MD PhD programs at New Jersey Medical School, facilitating research and advancing pipelines for physician scientists at New Jersey Medical School, have downstream effects, I think, throughout our UME and GME and CME programs as we generate and grow physician scientists. Dr. Bessman just recently joined at the Center for Immunity Inflammation and brings very interesting research related to inflammatory bowel disease. In the Public Health Research Institute, which is now becoming more incorporated into the Emerging Pathogen Center, and Dr. Aland, we have three new faculty that have joined, Dr. Barrage, Dr. Bruniers, and Dr. Gurini, and we welcome them to the faculty in the Department of Medicine. And of course, our new Vice Chair of Administration, Dr. Fernandez, who joined with us just after the new year and has got his feet deeply sunk into all the administrative issues in the department and the school. This past year, we had 9 promotions in the Department of Medicine. We're very proud of that. 5 of our hospitalists were promoted to assistant professor. And we've had 5 faculty promoted to associate professor in infectious diseases, Dr. Sanimo, Dr. Chu, in pulmonary critical care, Dr. Greenstein, in hospital medicine, Dr. Patel, and in the basic sciences, Dr. Siracusa was promoted with tenure. So congratulations to all of these faculty. There were faculty awards from the New Jersey Medical School Faculty Organization. The Distinguished Career Award, which just got announced recently for this past year, was David Alland. So congratulations to Dr. Alland. Last year, these awards got announced in fiscal year 21, so including them here as well. Distinguished Career Awards, both in the basic sciences and clinical sciences, went to faculty in the Department of Medicine, Dr. Rameshwar and Dr. Jaker. And that was really very nice for both of them. Both have been here for a long time and provide outstanding work in their respective areas. And the Faculty of the Year Award last year was Dr. Swami Nathan. So congratulations again to all of those faculty. The New Jersey Health Foundation presented the Excellence Research Award to Dr. Siracusa for his work in immunity and inflammation. And Dr. Ferdine received the New Jersey American College of Physicians Laureate Award for her work there over the past several years in leading the education programs and in serving as the president over the past year. Faculty Teaching Awards from the house staff in the Department of Medicine went to Dan Matassa at University Hospital, Dr. Sender at the East Orange VA Medical Center, and Dr. Sapru at St. Barnabas Medical Center. So congratulations to all of you. And the Faculty Mentoring Award from the Resident Faculty Council was awarded to 4 people this past year. Dr. Wang, our program director for our medicine pediatric program, was awarded the Faculty Mentoring Award from the Resident Faculty Council. So congratulations. We had numerous house staff awards for various achievements and accomplishments in various areas. And you can see that here on the slide. So always want to acknowledge our house staff who just do tremendous work and who are real partners in the excellence of healthcare and quality and research that we achieve in the Department of Medicine. There were some external awards for some of our house staff. Dr. Abreu received the Exemplary Award from the New York Dominican Consulate. Dr. Choi received the American College of Gastroenterology Award for the Best Abstract. Dr. Ademiris and Rim from the Digestive Disease Week, also Gastroenterology Conference. Our residents and fellows did well in some of these challenge bowls. Our residents won the New Jersey Challenge Bowl, Dr. Ampe Admirs and Forsberg, and our cardiology fellows placed 3rd in the country in Jeopardy. They were first on the East Coast. Congratulations to all of you who achieved that. Governance in the hospital, the school, and across Rutgers is well represented in the Department of Medicine. Dr. Pereira is the president this year of the Medical Executive Committee at University Hospital. Dr. Sutherland is the president-elect, so she'll be taking over when Dr. Pereira's term is completed. The New Jersey Medical School Faculty Organization, the current president is Dr. Solanki, and the vice president for clinical is Dr. Raghavanshi. Dr. Persopoulos is the current president of the RBHS Faculty Council. And Dr. Katari from the Department of Medicine is the designated institutional official, or the DIO, for all of GME programs at New Jersey Medical School, and represents the New Jersey Medical School on the Health Education Executive Council for the Rutgers and RWJBH enterprise that is now an integrated enterprise of GME education, encompassing over 1,600 GME learners. In terms of who we are in the Department of Medicine, We actually have a faculty of voluntary and full-time of over 700. You can see the breakdown by men and by women, both across the voluntary faculty and the full-time faculty, which is here at NJMS. The full-time faculty are more evenly distributed between men and women compared to our overall and voluntary faculty. Among the full-time faculty, we have 107 that are clinical and 25 that are basic science. And again, you can see the distribution between men and women across the clinical and basic science faculty. We look at the numbers of men and women in the various ranks. The majority of the faculty are the assistant professor level, and then the associate professor level, and then the professor level. Clearly, as ranks progress, there is a predominance of men over women. One of the important things to look at when trying to get some understanding about that is looking at years in rank. And you can see here that at the assistant professor level, women are about 3.8 years, men about 4.6, associate 6.8 and 7. And the professor level, women are 13 and men 10.8. The professor rank is a terminal rank. So it takes numerous years to get the professor rank. It signifies that earlier on, probably there were, and we know this for a fact, fewer women than men. But we need to continuously pay attention to this to ensure that there is equity and parity between men and women as they move through the ranks in the academic environment. We have 107 residents in the program and 62 fellows. Next year, we'll have about nearly 120 residents as our third year with partnering Barnabas comes into fruition, and we'll have about 12 or so more residents in the program. You can see the breakdown here between men and women, about 60-40, and the breakdown by diversity. Again, lowest in Hispanic and Black, which is something that we pay careful attention to. In the fellowship distribution, it's even a greater difference between men and women and less representation in Hispanic and Black populations of trainees and learners. This is something that is a national issue, but also an issue for us, and certainly something that Rutgers University, through President Holloway, and through all of the various schools that are part of Rutgers University, are really making a very concerted and focused effort to understand how we can improve on our diversity. Resources are being made available through Dr. Holloway's office, through the President's office, and through RBHS to really try and enhance our diversity. It's an area of focus throughout the environment, and certainly in New Jersey Medical School. So I want to switch and talk about some of the specifics on our clinical programs and some of the quality of our clinical programs. And again, it's a very challenging thing to try and capture all of these issues on the clinical side, the education, and the research. I'll try and highlight some things, and again, things that I miss, I'll be glad to come back to. So in terms of our overall activity as the clinical efforts that we provide, here you can see the number of discharges or admissions at University Hospital, the Department of Medicine compared to the other departments. This comes straight from University Hospital. We have about 55% of all the discharges that we take care of. You can see that here, nearly 8,400 discharges, another 700 patients who are under observation status. So that was over 9,000 patients that we took care of in fiscal year 21. We take nearly the majority of the patients from the ED, and again, nearly the majority that are admitted and discharged from University Hospital. Our ambulatory visits have increased. You can see in fiscal year 20, they were down. That was obviously in the throes of COVID, but have come back actually very strongly this past year. Our number of, for example, primary care visits increased by 27%, now approximately about almost 23,000 visits a year. So we do quite a bit of primary care, and the specialty services also have increased nearly across the board. So our fiscal year 21 ambulatory visits were up quite a bit, as you can see over here. This is a look at our eHealth and on-site visits, and you can see here back in March of last year when the pandemic started. Well, it started really in January, February, really hit us very strongly starting in March. And as you can see here, we started with some eHealth visits, and eHealth became the predominant form of our visits, certainly in the early days of the pandemic when we were shut down. The pivoting to that was just remarkable from all of you and from the technology we were able to implement. And you may remember Dr. Waller was extremely pivotal in facilitating that for the Department of Medicine and for many departments across New Jersey Medical School. What is certainly interesting to see is that eHealth remains. And actually, when we look at some of the data on this, for fiscal year 21 total, eHealth was a quarter of all of our visits. Looking at the last several months in May and June, about 20%, July and August, not shown here, about 15%, 16%. eHealth will remain, almost certainly as it is throughout the country, a new modality and method for providing healthcare to our patients, probably on the 20% level. And I think that's provided a lot of flexibility in how we are able to deliver care to patients, perhaps in a more efficient and continuous way to ensure hopefully better healthcare outcomes. So congratulations to all of you on being able to get this done. On the procedural side, our volumes certainly went down some in fiscal year 20. These are aggregates without going into all the detail of all these volumes, but certainly they have bounced back. Colonoscopy, endoscopy was challenged also by the unavailability of the ambulatory surgery suite for various periods of time during this past year for various reasons, because of problems in the operating room and problems as well in the ambulatory surgery suite. But we're seeing that come back now, and also with recruits of additional gastroenterologists, we think that volume will certainly come back to where it's been and more so. And we see a return of other volumes in other major areas, procedural areas in medicine. These are RVUs by location. You can see here RVUs have also gone up, consistent with our increased volumes, both in the ambulatory space as well as in the inpatient volume. And you can see our ambulatory RVU volume, about 40% or so of our total. The rest is on the inpatient side. Some overall metrics for the department. Our length of stay index really was quite excellent for this past year. We do it with including, excluding outliers. The outliers are the top and bottom 1% of patient length of stays, but our length of stay index was below 1. This saves a great number of days for the hospital. We have 8,500 admissions, and an average length of stay, let's say 6 days, being below 1 by 13% saves a lot of days for the hospital. So I think that's it's a very effective and efficient care. And kudos to all of you, to our hospitalist group who do this day in and day out, and to all of our residents and all of our attendings who rotate and provide and serve as the attendings on the resident services throughout the course of the year, and our other services as well. Our mortality index this past year is near 1. Last year, driven by COVID, and again, this is modeling based off what's called the Vizient database, but we don't think Vizient really accommodated for the mortality of COVID. Now, as they get more data into the database, they do accommodate for that in a better way. So our mortality index, again, which is the observed or the expected, and is a function of the severity of the case mix index of our patient population, is now near 1. I think what's interesting to see and is that over the last several months, you can see our mortality index has come down quite a bit. I want to really do a shout out to Keith Guevara, who has done deep dive with several others and the committee to look at the mortalities and to ensure that we're capturing both the severity of illness that these patients have, which impact the expected outcomes of the patients, as well as looking at any quality issues. So we're seeing our mortality index come down to below 1 in multiple months now over the most recent time, and we'll look forward to that as well moving forward into the future. To talk about some of our specific programs, general medicine under Dr. Natali really has 5 distinct areas in general medicine. There is the primary care service, and has a large role, obviously, in the ambulatory space, responsible for the training of all of our medical residents in ambulatory care, and provides education, training, and oversight of all of the residents. Also in the ambulatory arena, implementation of the continuing to grow Suboxone Medication Assistance Program under Drs. Gordon and Dr. Matassa has been a strong addition and providing much needed care to a challenged patient population. Medicine pediatrics under Dr. Wang provides this interdisciplinary treatment of patient populations, also within the Division of General Medicine. Preventive medicine, I'll come back and talk about that, under Polly Thomas, has done a great job and has recent expansion, and is the new joint internal medicine, preventive medicine residency program that was recently funded and approved by the HEAC committee within Rutgers, in which individuals can apply for a 4-year program, after which they are board eligible both in internal medicine and preventive medicine, and during which time they also can get an MPH. So it is a great new program. We're very, very excited about it. We think it'll provide great strength to preventive medicine, which will have a translation into population health and other arenas in improving healthcare outcomes. And the Geriatrics Program, I mentioned, Dr. Chin just joined us, and we're very excited about that. And he's established both an inpatient and outpatient geriatric practice, and we're looking to start the Geriatric Fellowship this coming July. And occupational medicine is looking to establish new programs in providing, and has done numerous things this past year, in providing oversight for vaccination programs for the state and for the city, and also partnering with the city in providing added health care. Some of the partnerships in general medicine: the Newark Community Health Center, that's an FQHC, multiple faculty in the Division of General Medicine provide services there, and it also is a potential site for student and resident education. We're very proud of that collaboration with the Newark Community Health Center. I also established under general medicine was the COVID Comprehensive Recovery Program, which facilitates patients with long-haul COVID to receive directed care. And we were proud to be able to set that up, and congratulations to the division for being able to do that. There was multiple support provided for the state COVID vaccination site, and more recently now for the Newark City mobile van program for COVID vaccination. There are other outreach and community initiatives also that are supported by the Division of General Medicine. Some very important programs as well that are funded from the Division of General Medicine. A couple of these relate to cancer screening programs. The SAVE program, now in its 25th year, provides early detection for cancer, breast, cervical, colorectal, and prostate cancer, and partners with the oncology group and CI&J for underinsured and uninsured community members. Also, the HOPE program does colorectal cancer screening, education, and prevention. The Nicholas Clinton Foundation grant has provided the integration of behavioral health into primary care, which is a recognized need in the delivery of primary care services nationally, and so the integration of that into our primary care practice has been a great addition. I mentioned some about the development of this opioid use disorder program, which has been under Dr. Gordon and Dr. Matassa, and they have had achieved some grant support. And there's additional grants on the educational side that have come through the Division of General Medicine that are supporting our medical students, supporting health, equity, and social justice through the Hispanic Center of Excellence, which has been under Dr. Soto Green for a very long time. And some other training grants, education grants under Dr. Ayala. I mentioned about the preventive medicine. I just want to call that out. This is a fully funded program under Dr. Thomas. And again, just recently, a 5-year HRSA grant for $3 million under Dr. Thomas, Dr. Ferdian, to fund this new internal medicine, preventive medicine program with a focus on maternal health. So congratulations to all of you for achieving that. One of our great programs for a long time has been in the ID and HIV arena. The HIV program under Dr. Swaminathan provides care to nearly 1,700 patients, and has leveraged HIV care to reach out across intersecting vulnerable patient populations in transgender health, in substance abuse, as it relates to HIV prevention and treatment, and now more widely in prevention. The program has been funded extensively through Ryan White funding and other program revenue, and also has funding from the CDC. So it's really just been a remarkable program that really is a national leader in HIV prevention and treatment. Just to point out the demographics of the patient population in this program is predominantly African American and Hispanic, and also across LGBTQ and with cisgender, transgender patient populations. The outcomes of the program have remained outstanding. This is the portion of patients on heart therapy with really essentially undetectable viral loads, and it's a national leading benchmark that's achieved in this program. Shifting over to hematology oncology, which really has come forward in leaps and bounds over these past several years under the leadership of Dr. Arap. There has been a whole slew of multidisciplinary engagements with the recruited faculty over the past several years across departments to achieve better outcomes and better health for all of the cancer patients across multiple domains. So you can see that over here. Some of the things that are very exciting for this coming year are the fact that there will be 2 new linear accelerators that are expected to come online this year for external beam radiation therapy. There is a new prostate cancer brachytherapy service line that's in partnership with radiation oncology, which is also very exciting. There have been numerous operational improvements, extension of extended hours for infusions, new space that's been realized to provide added services for the patients in the program. Much community outreach also occurs, and in the Division of Hematology Oncology, in partnership with the Division of General Medicine, mentioned some of the programs related to SAVE, but there's many community affairs and many other outreach programs that the division participates in to try and really bring cancer screening to the patient population in Newark. For a long time, patients in Newark and Essex County had the highest severity of cancer disease by the time they presented because of the lack of screening and awareness around cancer. And it's really great to see that the group has made a huge effort in this area, and hopefully we'll see that improve significantly over time. In the cardiac arena, this is a great award that continues. This is the Gold Plus Award for the treatment of patients with heart failure from 2021 from the American Heart Association. And under Dr. Solanki, this program continues with great success. This is the most recent Joint Commission certification of distinction. They just visited here about 2 weeks or so ago, and we're very impressed with the program. And hopefully that will receive another certification from the Joint Commission with distinction. We look forward to hearing about that shortly. Other programmatic issues in cardiology, I mentioned the cardio-oncology service, the recruitment of Dr. Feldman, very excited about that, and then the collaboration with the hematology oncology service in improving and delivering expert cardiac care to the oncology patients who often receiving chemotherapeutic agents that can be cardiotoxic. In interventional cardiology, this AngioVac program was started, which is a way to treat masses in the heart without having to do open heart surgery. And also we will be expecting in the next 2 weeks a new director for interventional cardiology to join the program. Electrophysiology and Dr. Aziz has continued to innovate, multiple trials going on with wireless pacing, both from the right side and the left side, with both direct treatment for AV block, atrioventricular block, as well as for treatment of chronic resynchronization therapy, advances in stroke prevention as well. And so all really very exciting things that continue to occur in addition to the all the other work that's going on in electrophysiology. Cardiac imaging continues to increase, and I just want to point out cardiac MRI and cardiac CT under Dr. Waller. Those numbers continue to grow, and as the hospital upgrades its MR and CT capability, that will have marked impact on our capacity to perform cardiac MRI and cardiac CT, which really are the becoming more and more the imaging of choice for a whole slew of underlying cardiac abnormalities. I want to call out the Comprehensive Weight Management Center, which was established this past year under co-directorship with Lizette Cespedes from medicine and Dr. Aziz Merchant from surgery. Within that Comprehensive Weight Management Center, Dr. Devani Doshi from general medicine serves as the medical director. This has been a tremendous success. This program continues to grow, and it's being supported in great measure through the Department of Medicine, also with recruitment now, as I mentioned, of Dr. Haji Pathelian, who brings to the table bariatric endoscopy that will offer the patients not only medical interventions, but also bariatric. And of course, we have the surgical interventions that are offered through the Department of Surgery. So this is a unified program, and it's really been a great success, and it continues to grow. In endocrinology, Dr. Bleich's LifeMap application is getting greater and greater attention. It's a personalized cloud-based diabetes management system that's continuous online for patients and that interfaces with their with various testing devices and provides direct feedback to patients. Also, the continuous glucose monitoring program that put together by Dr. Cespedes, Dr. Raghuvanshi for our patients to improve their outcomes in diabetes management. I also want to note our hospital medicine group, who are the core and the backbone of the inpatient services. They're a group of 15, and they do provide a huge amount of care, obviously in the hospital. They have provided the majority of COVID care, certainly over really the last year, since after the first wave. They have a marked impact on overall length of stay, and they do great consultative work with all the other departments at New Jersey Medical School and University Hospital. So thank you to the hospital medicine group. In pulmonary medicine, we've had for a long time now the Global TB Institute, though it should not be taken for granted. There are only 4 of them in the country. This is under Dr. Allard Zabel. It's a CDC designated center of excellence, and our centers for the northeastern part of the country, and it's a highly funded enterprise. It also provides direct patient care through the Lattimore practice, and Dr. Petruala heads that up, and again, has been an ongoing real success in pulmonary medicine. There is new collaboration between the Global TB Institute and PHRI, which is leading to real translational science research, and it's very exciting for that to have occurred. That really started this past year. In pulmonary medicine, in addition, there's been expansion and increased funding secured for low-dose CT lung cancer screening. And Dr. Berman, who has done that, the SLEEP program continues to grow. And again, with Dr. Berman, we're hopeful that we'll actually have a sleep lab this coming year with UH. The program is renowned for being a regional point of care ultrasound training program. Actually, it's really national, not just regional. Faculty in the division provide training across the country. Locally, where there's expansion of our ultrasound guided bronchoscopy program, and the division under Dr. Berman co-directs the Interdepartmental Sarcoid Center. The rheumatology group with Drs. Capatil and Kiani are as busy as always and continue to innovate. They actually are now providing clinical educational training at Trinitas. They've created a new elective for their fellows, expanded ultrasound for their fellows, and in allergy have now established an outside rotation in pediatric allergy. And so we're very glad that that has occurred, and those programs remain very, very strong. In our hepatology and liver transplant program, I think people have heard some of the great successes that have been noted this past year. This past year, 33 transplants were performed, and that's in the throes of COVID, in the throes of issues in the operating room where there was floods for a period of time. So that actually is quite an achievement. Also this past year, the first transplant was performed with a machine-preserved liver, and that was an innovation from Dr. Guerrera and Dr. Brasopoulos, and Guerrera head up at the liver transplant program. And the liver disease, the Advanced Liver Disease Center and Transplantation was recognized as Center of Excellence by Optum, which was a very big recognition. I think what's really remarkable is you can look over here. This is the data that comes from UNOS, United Organ Sharing Network, showing the 1-year patient and graft survival. And you can see here over the past 2 years, the marked improvement and increase in patient survival, so much so that in fact we were ranked number in the top 5 in the country in this past year. You can see here the rankings. We're number 1 in the region by far. The closest program is at Montefiore, and that's the only one in the top 15. So really a remarkable achievement by the Advanced Liver Disease and Transplant Group, and kudos to Dr. Brasopoulos and Dr. Guerrera for achieving these outcomes. Just tremendous work. Also in gastroenterology, the establishment of inflammatory bowel disease clinic under Dr. Nababi really has been a great addition, both for patient care and for training. And also, as I mentioned, the recruitment for advanced and therapeutic endoscopy, including bariatric endoscopy. So that kind of touches some highlights in the clinical domain. I know it's a lot, I'm moving a little bit quickly, but I want to do justice to, as possible, to all the different sections. In the educational arena, it's been actually remarkable. I think that I can, I'll just say you did it. And by that, I mean that if you remember a year ago, as we're coming out of certainly a little over a year ago, the acute phase of COVID, which really started in March, April, May, and into June. As we came out of that, there was a tremendous pivoting that was required around education. It was around all of our programs, our GME, UME, CME programs, all the virtual recruiting that had to get put into place. All of you in the faculty and all the program directors really were absolutely remarkable in what you're able to do to pivot and do things virtually and recruit for our GME programs, provide education on the UME side in partnership with the education office in the medical school under Dr. Straba and obviously Dr. Soto Green. Really a remarkable accomplishments and achievements, and done with great outcomes. And I'll show you some of that in a moment. But our recruitment in the GME side was probably one of the best ever, and all the programs were really superb. So congratulations to all of you on that. In the GME program side in general, all the programs are fully accredited. We had a record high number of applicants this past year, and a third of our new interns were New Jersey Medical School graduates, which was really great. We love getting our medical students that stay with us in the program. It also was the second year this past year of integration of the internal medicine program, which is in Barnabas Medical Center, and they have been great partners and responsive partners, and really that has worked out just tremendously. And really kudos to Dr. Sunil Sapru as the program director there, and also Dr. Paul Yadiche, who's the chair of medicine over there, really have been extremely responsive to all the issues. Dr. Greg Rokas in charge of the educational programs globally within the Barnabas healthcare system. Also within the general medicine residency program, the urban population health track under Dr. Emily Gordon is now expanded. There are 7 residents in that track. There are 12 residents in the clinical educator track under Dr. Ferdian. So congratulations on all of that. As I mentioned a couple of times, we have this new 4-year combined internal medicine, preventive medicine residency, which is fully funded, and also where the residents can get an MPH during this 4-year time. So very busy, very busy residency training program. There are new electives in hematology and oncology. I want to thank that group for putting that together. The ABIM pass rate is 99% for the past 3 years, which is a really outstanding. And all of our residents matched into fellowship programs this past year. There's a collaboration with ophthalmology where we take those residents, they train in the preliminary medicine years with us. Medicine, pediatrics also is 100% match. We have 16 residents in medicine and pediatrics. They have just been, those residents just have been superstars, really terrific. Dr. Wang just recently received a grant award for international health education, where we'll facilitate residents to do electives abroad, and particularly in areas of the world where there are underserved healthcare. There are numerous special events that go on. They were all virtual this past really a year and a half. Perhaps we can do some of them in person this coming year. We'll see, depending on how things go, obviously, with COVID. In the fellowship programs, we have fellowships across all the specialties within medicine. We had 23 new positions for this past year. We had more than 2,000 applicants. Some notable new things in the fellowship programs. We do have an expansion of the GI fellowship training program at Jersey City Medical Center. So 2 new fellows at Jersey City as part of our GI fellowship, which is really great. And also the expansion of the pulmonary critical care program at St. Barnabas. 2 fellows started there this past year, and we think that's going to go up to a full complement of 5 this coming year. So very excited about that, and kudos to both programs for getting that done. We have approval for the Geriatric Fellowship, which between UH and the VA system, and we're looking forward to getting that going this coming July. And the Advanced Endoscopy Fellowship was reestablished this year, fiscal year 21. I want to really make a call out to the clinical conferences, that there are more than 60 hours of conferences per week that are provided in this program across the various training programs in the department. And just that'll be part of a supplement to this presentation, which itemizes all the different conferences that go on, that all became virtual as we went back to our regular conference schedule really last June and July. So kudos to all the programs and all the education and training. And this is conferences that go across the board and are available to medical students and residents and fellows, and also to faculty. And so again, to all the programs, congratulations on that. In the undergraduate arena, the department is heavily engaged and provides lots of education in the medical school. I'll call out some of the particular programs. And there's been some transitions this past year. What used to be called the patient-centered medicine course, now transitioning to health humanism and health equity. Dr. Cespedes has been the course director of that, and she'll be the course director of the Health Equity 1. And Dr. Della Piazza has been very involved in health equity, will remain the health equity content expert. This is also becoming in this coming year, Health Equity and Social Justice 2. Again, Michelle Della Piazza, Dr. Della Piazza is the course director for that, and she has done huge work in this arena for the past several years. So big change in how the educational programs are running in the medical school. These programs transcend the traditional educational programs that go on throughout the first and second year. I'll also point out that in the third and fourth year, Dr. Ayala takes on the continued link in terms of health equity and social justice in the training for the third and fourth year medical students. Dr. Berman continues to lead the pulmonary systems course, Dr. Jarula, the cardiovascular systems course, Dr. Kaplan is the clinical content lead for nephrology. Dr. Tendler runs digestive system and genitourinary and endocrine for the school and provides continued leadership in those arenas. In addition, the third and fourth year medicine rotations, Dr. Feingersh is the clerkship and acting internship director. I'll show you some outcome data on that, and she's that's just working terrifically well. Dr. Tso is now the course director for the third year ambulatory primary care clerkship. So thank you, Dr. Tso, for taking that on, and really well received by our medical students. We have numerous faculty that have been learning community faculty. Dr. Cueto, who actually unfortunately just left and moved to Florida. Dr. Doshi, Drs. Paris, Tso, and Tendler, so provide this continuity of learning community throughout the 4 years of the medical student experience. Dr. Elzadeh Duque has been working in student support and doing a great job in that. See Dr. Tendler in educational informatics, and the student-run health clinic, which I think is back up and running. We have numerous faculty participate in this. This, of course, doesn't take into account all the numerous hours of lectures that many more of you all give in all of these courses that we spoke about. So thank you all for all this great participation, both on the didactic side, that's predominantly the first and second year, as well as on the clinical side in the fourth years, and all of the efforts in these arenas. It's been a tremendous success. Just to point out, this because it was a significant change in how the medical school is approaching education in the first and second year, with the revamping of a program now and what's called the H, Health, Healing, Humanism, and Health Equity, again, run by Dr. Cespedes, Dr. Kemp, Robin Kemp, with Dr. Della Piazza as a content lead in health equity, and Dr. Ayala also serving as core faculty, bringing this forward to the third and fourth years. And here you can see how this transitions year 1, year 2, year 3 and 4, and then to residency. This is specifically focusing on the anti-racism curriculums. And again, our faculty deeply involved with Dr. Soto Green in delivering on these topics and this training to ensure health equity and social justice for our learners as they come out of healthcare. Sorry, somebody's phone, if you could put that on mute. This is the annual questionnaire that is completed by our graduating medical students. And I want to point out this top line. We had a 98.6 good to excellent rating for the overall educational experience of the medicine clerkship. That the 90th percentile for all schools in the country is 97.1. So we were above the 90th percentile in terms of how our graduating students rated our medicine clerkship. So just kudos, again, Dr. Feingersh running an outstanding program, and kudos to all the faculty, all of you who are involved with our medical students, who spend the time and the effort to engage with them, to teach them, to train them, to learn with them. Really, it's just, it just really shows, and we're very, I think you all should be very, very proud of this, and certainly I think the school is proud of the department in achieving this kind of rating from our medical students. I also want to acknowledge the faculty that are involved in the graduate school education and training. Dr. Matthews runs and teaches in several courses. Dr. Rameshwar does a lot of work in stem cell biology in the graduate school, which is also available and also open to residents and others who wish to participate. Drs. Yap and Salgami on advanced concepts in immunity. Dr. Weinstein also leading a course on the immune system, and Dr. Weider, who is teaching several courses in cancer biology. We also have 21 graduate students in the department who are pursuing PhDs in the various labs of the Department of Medicine. And I want to give a shout out to Dr. Rameshwar, who had a successful completion of an R25 training program that was the year one. It's, I think, a 4-year program, so they focused on training underrepresented minorities as clinician scientists. So congratulations to that. It was very successful, and it got very, very positive and strong feedback. On the CME side, I'll just call out some programs that have been in place now for the last several years. You can see here, this was the 8th annual update on liver disease run by Dr. Persopoulos that occurred this past November. And this was the annual digestive disease update that occurred last September and this past weekend as well. So those programs continue. They are now hybrid programs, both virtual and in person, as they transition from a fully virtual last year to hybrid programs this year. Congratulations. And many of the faculty in the department participate in these programs. So congratulations to all of you to do that. We don't have that much time left. And I can tell you that research and scholarship is really been also a remarkable achievement this past year. Just doing a PubMed search, there are 231 peer-reviewed publications from faculty in the Department of Medicine, and we have that as a supplement, and that includes all the publications across the department that our faculty have done, which is just remarkable. Our residents have participated in many of those. We had a very successful Department of Medicine Research Day that was virtual, again, with really a record number of abstracts that were submitted. We had 4 oral presentations that were live via Zoom. That was very successful. From the Research Day, we had, these were our winners from the residents and fellows in terms of their presentations. And we're really very proud of all the effort that the residents and fellows do in terms of research, and also want to thank the faculty for participating with them in all of these research projects. There are many clinical trials going on in the department. Obviously can't go through them all. I'll just kind of put them up here in hepatology and liver transplant, many trials for advanced liver disease patients looking to prevent progression to advanced liver disease through many multiple different pathways and mechanisms. In hematology, oncology, a great number of trials that also partner with other departments and specialties across the board in GI and GU, and you can see this in GYN, in head and neck, and kudos to our hematology oncology faculty in working and identifying appropriate patients for these clinical trials to advance care in oncology, which is very dependent on these types of studies to provide best care to patients. Also want to point out that in addition to the clinical trials, Dr. Arap and Pasqualini are the recipients of multiple R01 grants that look at multiple basic mechanisms and clinical therapeutic targeting mechanisms for the treatment of oncology, and they've had a successful research program for many years and are continuing so, and congratulations to them. Also in hematology oncology, I mentioned Dr. Rameshwar's R25 grant, other grants that she has in stem cell work. And Dr. Weiss, who's in the division of Hem-Onc, also was very successful, received an 5-year R01 grant this past year, looking at interplay between long-term drug abuse disorder, who are known at high risk for HIV, and their outcomes. It's a very interesting grant that we hopefully will hear some reports on in the future. Very excited about that, and kudos congratulations to him and Dr. Rosenblum, who was a great help in getting this done as well. The PHRI and EP Center has been absolutely remarkable in what they have done under the leadership of Dr. Alland. The combined institute and center conducts basic, preclinical, and clinical research on bacterial, viral, fungal, and parasitic diseases. The focus on TB, COVID-19, and HIV. There was a COVID-19 center that was established this past year as well under Dr. Alland, and they have done a tremendous work in looking at various mechanisms of COVID-19, looking at immune responses to COVID-19, and understanding diagnostics and therapeutics in COVID-19. It's not possible to capture all of the work. I've just highlighted some things over here. And you can see some of the key scientific advances in 2021. This is all related to COVID-19 that's occurred this past year, and a lot of work that's gone on, continues to go on internationally in TB. I want to also give a call out Dr. Elner, who's a former chair of the Department of Medicine, who has been absolutely singular in driving the innovation on the international level. On TB research in again multiple countries, and with great funding and innovation in TB research, and I want to just acknowledge that. On the clinical side, the HIV program also became a part of a network, the coronavirus prevention, the ID program, leveraging all of their infrastructure in HIV, also became part of a coronavirus prevention network, and as you all know, participated in the early studies in the Moderna vaccine, and has been involved in numerous other studies looking at antibody treatments for COVID in various parts and stages of the illness, inpatient, outpatient, and has been just has made major contributions in COVID-19 on the clinical side. There is also work done by the group in terms of treatment and the interplay between opioid addiction issues and HIV patients and other patients at high risk. Dr. Nyaka received an R01 grant this past year on this, and so congratulations to her for that. Other clinical trials going on in various groups. You can see here in pulmonary and critical care, these were important trials also related to COVID-19 that were published in JAMA in the Journal of Medicine. In cardiology, numerous trials, both in heart failure and electrophysiology, with new devices to treat various underlying diseases in cardiovascular pathology. I want to also call out some of the work in the Center of Immunity Inflammation. This particularly relates to some of the work that Dr. Siracusa is doing, which really is fascinating in terms of looking at neuromodulation of immune responses, and also this idea of immune environments changing based on prior infections and what that means for future infections. So I don't have the time to go through this, but it's really fascinating work, and kudos to him and the group and Dr. Gause for their work in this area and for all the funding they were able to achieve. I'll just close with just a couple of last slides here. Just make a couple of comments around the finance side of the department. The department has been doing well. Our overall revenues continue to increase, both in the clinical side and on the research side. Here you can see some of our clinical revenues in the green here, some of our funding from University Hospital, also our direct and indirect funding from various research projects. I will note, as I've kind of alluded to, that the EP and PHRI group and the HIV and ID group have really had tremendous funding, Global TB Institute and others, and this is the total funding for the department at the present time. So I'll just end with a quote from Osler, who said that live neither in the past nor in the future, but let each day's work absorb all your interest, energy, and enthusiasm. The best preparation for tomorrow is doing today's work superbly well. I want to congratulate the department, every single person in the department, who, despite the enormous challenges of this past year, year and a half, really have remained focused on delivering what we know we need to do, which is to provide care to patients, to educate and train the next generation, and to advance the science of medicine and healthcare. And I hope that the data that I've shown you has shown how much you have done, how much you have achieved. And I'm extremely excited for what the future holds. We have so much more yet we can do. And it's just really exciting to see what's been done and how many doors that opens to what yet we can do. So I want to thank you all for joining this morning. I hope you found it informative, and I look forward to our ongoing work and conversation. Thank you so much.